Good morning. My name is Michael Kelker. I teach English at St. Charles Community College, and I am also the organizer of Democracy Days 2001 to present. Welcome to day 2 of Democracy Days 2020. I'd like to call your attention to a program booklet at the top of this web page. I'd like to direct your attention there because not only do we have an outstanding session lined up for the 10 o'clock hour today, but we have more going on at 11:30 and 1 o'clock today, and then Wednesday and Thursday as well. If you are on a mobile device, you can participate in the chat. I think you need to click a link below the screen there, and we will be conducting lively chat at the appropriate time. In a moment, we'll hear from Vi Rajagopalan, and she will speak about the pandemic and mental health, a most critical subject. So please keep your questions and comments in mind and post them in the chat function, and I will convey them to Vi when she is completed with her presentation. Vi, thank you for being here, and take it away.
Thank you, Mike. We can end this. Yes, we can. We've heard these kind of phrases before, but it is our time. We can end this. And who am I? I'm Vi Rajagopalan. I'm professor, chair of psychology department. I share my role as a chair with Professor Mitch Harden. Some of you may know him. And we work for St. Charles Community College. So let's start right away with understanding these terms. The pandemic. What does it mean? It's been thrown at us so many times. But before I go there, I have to say I have to thank the Democracy Days Committee and especially Professor Michael Kelker for giving me this opportunity to discuss not only the pandemic, but also about mental health. And so let's start. What is this pandemic about? What is it in relation to? Yes, the name is coronavirus. Oh my God, so close to my name. It's purely a coincidence, believe me. But this coronavirus seems to have taken over everywhere. Even my 88-year-old aunt in India knows not only coronavirus, but she knows asymptomatic people and why they don't carry the symptoms outwardly. I was blown away. And so let's start with defining pandemic. Pandemic is a word that has been defined by World Health Organization, biologists. I chose Wikipedia and the Webster Dictionary because that is close to all of us. So this is a disease, an epidemic that has spread all across. And it has gone through worlds, countries, worlds in the sense on Earth. And it has become something everyone is dealing with. But we've had other pandemics. The 1918 influenza pandemic. I wasn't there. I may be old, but not that old. But we all know what it did. It wiped out significant number of people from the face of Earth. The 1980s, HIV/AIDS. Well, I was there. And no one told me it's going to come and attack me. But if I avoided touching certain things, being around some people, there were a lot of prejudice and bias around those people, I wouldn't get it. Then came the flu pandemic, H1N1, the swine flu. That's really dear to me because I got it. And I was new to St. Charles Community College. I remember my students sitting in the front row one Monday morning and telling me she had just come out of the hospital and she had been released and told she was treated for H1N1. And I got concerned because people who know me, at least my family members, think I'm kind of a little bit more anxious than the guys in my house. Yeah, I'm the only woman. H1N1, I did get it. Along with the flu, they told me. I don't know, I thought they were the same. But it could zap me out. But no one at any point said, we'll think about treating you, whether you're a candidate for treatment. But look at coronavirus. In the beginning, and you can call it COVID-19 if you want, but in the beginning, we were told that people with certain disorders like diabetes was on top. And I have type 1 diabetes. We were told that the medical team is short of many things, doctors, equipment, and so on. So they may choose. Of course, my anxiety went up. Is it anxiety or fear? We'll come to that. But definitely it has affected us in many ways. And it's not just me. It has affected, let's see if I can move this. So initially, the coronavirus was something that we feared. Fear is an okay thing. I'm going to tell you why. Fear is what we develop towards certain stimuli that is life-threatening. It's life-saving emotional equipment we have. It's part of being mentally healthy. But then we went like this. Oh my God, it's all over the place. And we got in out of fear. We got into our homes. And some of us went to the store and bought up everything, right? I couldn't find toilet tissue. And then there came, you can't go out without covering yourself because this travels through the air. We heard that. And then we started developing beyond the fear of corona. What's going to happen to us? So, by the way, I want to make an announcement right at the beginning. I will not be taking any political stance, nor attacking my husband or family members about just for joke's sake. But nevertheless, I have chosen to go this pathway. That is, how do we equip ourselves with good coping mechanisms? In order for that to emerge on the top, we have to understand what the problem is. So let's look at fear versus anxiety. Fear is a central nervous system's response, and it's both physiological and emotional. Physiological because when you have that fight or flight kind of thing going on, and some of you have heard from psychology professors, biology, and whatnot, that there are two systems, sympathetic and parasympathetic nervous system. Sympathetic nervous system helps us deal with the situation by giving us more energy, fuel, whatever you want to call it. And then once the tiger leaves, or the threat leaves, we tell ourselves, oh, thank God, that's over with. Some of you may have experienced fear when I announce an exam, remind the class, they have known it. Oh, she may forget, but no, our exam is next week, I tell them. And then they experience fear. This fear up to a certain point is good because it's a threat to your well-being. Being academically successful is one part of that. So you prepare yourself. And I have told you many times, other professors have told other students, prepare yourself well. And this is not going to be a difficult test. So fear up to a certain point is good. It helps us develop coping skills. But this fear of corona, what is corona? I haven't seen anything directly. They show this beautiful picture of pinkish, a flowery kind of object. It looks pretty attractive, but they say it's the most dangerous thing around now. So we developed fear with that. But then it mushroomed. When I heard, I may not be treated. I needed to change my sensors. People were saying I can't go visit my elderly parent. Then we realized that there's more to it. College shut down. I never for a minute thought on that Friday of my midterm exam that I'm not going to be walking back there during this year again because I chose to teach remote. So this fear, which was directed towards a certain thing or event or an object or a person or whatever, it's very precise. And when that fear emerges, we equip ourselves with possible solutions. We come up with some impossible things that we haven't done before. But anxiety, on the other hand, and if you look at it, most of it is same as fear, I say central nervous system's physiological and emotional response. But then the phrase changes to vague sense of threat or danger. One cannot prepare or come up with solutions. And solutions in this psychological sense is good coping mechanisms. So we can prepare ourselves. So what happens when you experience this anxiety? The physiological changes are same for a while, but then it evokes a second system. And then you have this cortisol hormones keep coming in and disturbs metabolism and all the things we took for granted. So what happens when everybody experiences anxiety? Freud called it hysteria. I'm glad his and him maybe is combined as hysteria, but then hysteria was connected to women and their emotions. But now we call it anxiety. Anxiety has been defined, examined, and also we can cope with it at a certain level. But there's mass hysteria now. It's become contagious. I think this cartoon really, really gets to it. It's not easy for others around. When people are experiencing anxiety and that's all they see, then we start thinking that that's normal. And we're being told this is the new normal. So we forget to actually engage what we are good at, which is resiliency, that leads to good coping mechanisms. Anxiety, uncertainty is something we don't tolerate. Really, we don't. Think about all the good things that were happening pre-corona. One area I'm going to tell you is I used to complain about technology in my classroom, technology, and complain. Help desk knows me pretty well, and the instructional designers know me well. But this uncertainty, I started embracing. And I'm not saying my coping mechanisms are still working, and I'm not at the point where I can say I can do it alone, but I know what to do about it. I let go of this need for certainty. Ask Nick, who actually helped me start this thing. I was here at 9:30. And that was to make sure that the limited skills I have is going to work for me. But when you embrace uncertainty, you become powerless. Powerlessness causes something called learned helplessness, which actually is a real phenomenon that psychologists have studied. It means we take the stance, damned if you do and damned if you don't is what's happening to me. And so I'm not going to do anything but sit here and feel anxious. And what do we do? Well, when we feel anxious, we turn on the TV because we want to know when, we're all alone, cooped up in our houses. And all you have is family members who are looking at daggers at you. And so you turn on the TV. And so what have you heard? I know you recognize Dr. Falchi. For a man, I haven't seen him in a while, but he said the virus will stay its course. I told you I'm not going to politicize this, but my bias about being a social scientist is going to come through. And I'm trying to minimize it, but I have to say that that kind of drives what I do, what I can do at the individual level. So here's Fauci saying the virus will stay its course. But do we know its course? Of course not. We have the potential for vaccine. I hear that all the time. And I have a living scientist in my house. My husband is in medicinal chemistry. But one can't have vaccine, he says, because I start asking people I know, and they say for effective vaccines to develop, it takes time. And even if we have vaccine, that doesn't mean it's the end of the pandemic. Think about it. You've had the flu in recent times. But if that's not the case, what will? That's where I started thinking about taking charge of my own life, what I can do at this individual level. I'm not downplaying the corona threat in any way. It's there. But I'm not going to let some politics or politicians or some system to change in order to accommodate me. I'm going to do everything possible. My diabetes can be controlled by insulin. It'll bring the sugar down, but nothing else. I had to change the way of life. And my doctor didn't sit down and say, at 8 o'clock, you have to do this, 9 o'clock, you have to do this. But I came with a system. And I'm not saying I'm perfect by any chance, but I realize no one can take away my diabetes. It's there to stay. I might as well embrace it and come up with things that work for me. So the other thing is CDC. They don't lie. They just give you numbers. 192,388 deaths. Boy, that must be quite a lot of numbers. And then they tell us how many millions got affected all over the world. Then comes the White House. Again, I'm not politicizing this. There's Mr. President, who has been telling us lately, I don't want to panic people. But there's a difference between what I'm saying and what he's saying, I think. We are going to give the news along with what we have as something, a system that helps people to cope with. But instead we hear the economy has come roaring back. I see the economy, but I don't hear the roar, do you? The stock market has hit record high after record high, and I was excited before I realized I don't have that much in it anyway. New tax and reforms are in place. Maybe, like the vaccine, it's going to come, but is it going to be effective? My administration is going to bring jobs back. I want to believe in that. And the last one, businesses and educators should work together. Sounds like a great idea. We prepare our students for the jobs that are there. But what happens when those jobs change in the next 5 years? We don't, and I am very biased as a faculty member when I say, and I hope I'm speaking for everyone there, we are preparing our students to think critically and be able to survive in whatever jobs that they seek. They're special. I'm a psychologist, but I never thought I would be doing what I'm doing today. I thought I'll be teaching and doing some research. And I just embraced what life gave me. It took me time to cope with that, but I have had wonderful experience, both in the psychiatric center working as a psychologist, as well as in higher education, teaching in community colleges. So I say, listening to all this, but Mr. President, what about the COVID-19? Because we are looking up to him and all the people around him. That's what I did for a while. Then I realized I'm not alone. I don't want you to think you're alone. I was blown away when I know a lot of us like Michelle Obama, but it's not like 100%. But I'm taking her example because she's known for being very collected, poised, great speeches she makes. I just heard her speak in the Democratic Convention. And now she's saying, I have low-grade depression. That's not coming out of fear. That's anxiety. Even she's not sure. But she knows that this corona thing that has changed our lives, and no one has defined what new normalcy is. Normalcy is not going crazy at any point. So I'm saying to myself, wow, if she is going through this, then it must be something that we all are experiencing. And I'm going to share my personal story. I swear I won't harp on this because I can't talk too much about my family members. I made a promise and commitment to myself. So my younger brother moved in with mom 5 years ago, and he's the primary caretaker of mom with dementia. Why did I bring dementia here? Because from my own personal experience, if you can, and I'm not making mockery out of people with dementia, but as a caretaker, as someone who's not even close caretaker, dementia is a very difficult thing, not only for the person, but for people around them. If you can take care of a person with dementia, you can deal with corona, by the way. But he has had no relief, not even for 5 minutes. So when I called him 2 weeks ago, and he's actually the most patient person among the 4 siblings. And he was getting short at my mom, saying, I told you this 5 times, 20 times. I'm not going to repeat myself. I heard him yell. And really, that did something to my heart. And I started preaching. Oh, come on, she has dementia. And he goes, are you kidding me? Don't I know that? Then I realized, from being wise, some of the psychology background came. He needs as much care as my mother. And compassion and empathy for him is the most important thing. He's not able to do more than what he can. And then I'm worried about myself. I told you, being a type 1 diabetic, and I crossed out older, but my family members remind me, you're older, you have to slow down. I do admit here that I'm older, just a year older. During the pandemic, I had a birthday. That's all I'm going to admit. So older adults with dementia, what has happened to them? Many of my colleagues have shared their horror stories about not seeing their mothers or fathers and loved ones, where they have to stand out and wave to them, in the seniors living situation that they are in. And the caregivers who we depend on, my brother would have depended on these caregivers to help my mom take care of her hygiene, take care of herself, but he hasn't been able to find anyone. He doesn't want to Zoom or FaceTime with me because I know I've caught glimpses of her on Facebook by my sister posting things about her, and she looks unkempt. Should I worry about that or focus on the fact that she seems to be healthy otherwise? She hasn't done, look at my hair. I haven't seen a hairdresser, but I'm not going to worry about that. And most likely, they're not getting help from caregivers, but they can visit. My mom cannot go to the senior center and tell herself, God, I have less problems than some people around me. That's the good part of having dementia, I guess. I'm not. I'm telling you why, because she's healthy, she can walk, she can do all those things, except she doesn't realize that she's forgotten many things. Many of their routines have been disrupted, and so has ours, right? So older adults with dementia, if you come across them, do your best to support them by supporting their caregivers or directly supporting them. So it doesn't stop there. And now we have police shootings. I know my nephew said his girlfriend lives in Kenosha, Wisconsin. The first thing that came out of my mouth, you guessed it, concern. Protests, Black Lives Matter protesters and supporters are out there. Forest fires. When I saw our western sky turn orange on Sunday, and the sun, I have pictures of it to prove, sun looks like a burning sun. I was concerned. Of course, people closer to the fire haven't even had a chance to deal with the destruction from the first fire, and they're dealing with that. Unemployment has struck all the coasts and the mid. Political uncertainties, I've already said, I'm not going to take sides, but the political uncertainties is a given now. We're not sure who's going to do what. And then in the beginning of the corona, people were saying, I can't take it. My child is driving me nuts. I don't know how to deal with this. I can't work from home. And there's no one to come and take care of my children. We learned to deal with that. And then now we are worried that they're back in school. And we're not sure of their safety or what they're being taught. Some of them chose to stay home and worry about, are they really learning? We have uncertainties everywhere. Separation and isolation from loved ones. These are some of the identified things that people have been talking about. I kind of summarized based on some of the things I was looking at. So psychologists have said these are some of the factors that have affected us. Fire survivors, Black Lives Matter protesters, and also people who are accused of the rioting, and then supporters. So what do? We do what we know best. We pick up the phone and start doing this. Now, if you saw that people are going to school, people are talking to each other, everything is fine and dandy, it would be too boring to do this. So we call this doom scrolling. I got that from, a source. And then I also have Aditi Nerurkar, Dr. Aditi Nerurkar, Harvard Medical School expert. And I've summarized what she has said. And the reason for summarizing something from a psychiatrist rather than going to the usual, a publication. There aren't that many publications about what we have to do about this corona. How do we understand this? But then she makes it sound like this is something we have been doing for hundreds of years, and we have to take charge. This is not a good coping mechanism. Scrolling for bad news and disheartening. Oh my God, did you see that? And then we call our friends and spread that around. And we spend hours looking at what didn't happen, and what may happen is turned into, this is going to happen to us. There won't be any jobs. We are going to go bankrupt. This is all over the world, not just here. This doom scrolling is happening all over the world. And then she says, amygdala. I know amygdala. Many of you also should know that. It's the old part of the brain, we say. And amygdala is good at detecting threatening stuff. When we are afraid and fear go together. When you're afraid of the sound or something we see, God, that looks like a tiger in the bush, I'm going to run. The old brain hasn't evolved into the current contemporary context. So all we see is tigers. So COVID, metaphorically, is that tiger that we don't see, but it chases us, chases us, chases us. It's a perpetual tiger chase we are experiencing. So it is no longer tangible. We can't even pinpoint and say what exactly is going to happen, not to blame anyone. This is a very difficult situation. Nothing like this has happened before to us. But we have been running from tigers for centuries. So what happens? Okay, I told myself I have to give some bit of psychology and biological areas that relate to our behaviors. So fight or flight is a normal thing. And in uncertainties, it just goes up and up. And this tiny little thing called amygdala takes over the entire system. It hijacks the rest of the brain. The prefrontal cortex, which is in the front. So biology students, go tell your faculty, professors that they did cover some biology, okay? So this amygdala hijacks everything, and we are, really responding from our amygdala, which doesn't generate coping mechanisms. All it generates is this need to run or fight. If I see a snake, I'm going to run. My husband, on the other hand, and this really happened, he ran to the garage, picked up an axe-like thing. Oh, I'm not going to say, some of you may love snakes, but he did away with it while I'm screaming because my amygdala took over. Sometimes it does. So let's look at this doom scrolling. We have to start where we are. This is not going to go away anytime soon. But what if we look for, instead of proof of the bad, see, we told you they don't have any answers. Falchi was there, and then Donald Trump was saying this. And the doctors are saying they can't treat this without the proper equipment. That's all we hear. Did we hear about a resident in New Jersey going from place to place, actually running grocery errands for people? I didn't think so. The Sikh community, they wear turbans. They literally have taken over supplying food to many areas in the St. Louis as well as other areas in the world. We don't hear about that. Uh, when a woman actually stopped, took out $1,000 and gave it to grocery store clerks who were checking her out. We don't hear about that. Not often. I'm not saying we don't hear at all. It's there. So when brain responds in negative ways, it generates solutions and not make you feel, experience learned helplessness. I told you before. But what if you allow this brain to process good things? You start feeling gratitude instead of saying, oh, my friend wants something from me, otherwise she wouldn't be doing this. Or, oh, you have a headache again. Oh my God. So gratitude, compassion, tolerance. We have to have this. If someone is trying hard to change things for you because they haven't done so for many, many centuries or many years, and they're beginning to understand their biases and they're beginning to make changes, let's acknowledge that. And those who have not had the compassion, understand that this has really been going on in this community for a long, long time. So something really has to push them to feel that their lives matter. So let's look for proof of the good. It not only makes you feel good, but it actually, you don't have to go looking for happiness. It's right there. That's why I like the positive psychology area. I have been proponent of that. Because as a psychologist, I was trained to assess, diagnose, and treat abnormalities by reducing inappropriate behaviors and increasing deficient behaviors that are appropriate. But we had aggression, anger management to address aggression. What about creating opportunities for that person to show compassion, to show gratitude? They haven't felt it. And they immediately, I'm an optimistic person, start feeling that positiveness. If we focus our human positive virtues will start emerging automatically. Happy people don't go around spreading rumors or destroying property or destroying lives. Happy people are spreading that. Positive psychology area has a lot of research showing how happiness impacts a person. Even companies are looking to actually invest in their human potential. So what do? We embrace uncertainty, but that also means you have to change. You have to change your ways of thinking. And I go back to that fear and anxiety again. Something terrible is in your future is what people with anxiety. And I haven't even gone to people with actual diagnosis of anxiety disorders. I'm talking about people experiencing more than the above, the usual level of fear. Something terrible is in your future. How are you going to fix it? Tell me. Versus, I picked some things that were good coping mechanisms, just two of them. What if you were, this is because I miss my hairstylist. She had become my friend. And she's going through a lot. So many service areas have been affected due to closures during the pandemic. People in the restaurant business, salons, and name it. We are the fortunate ones, and I'm just talking about people who have jobs. And how about saying this? I work in a hair salon and I'm terrified that the closure is going to impact my income for the next few months. This is much more precise than saying this coronavirus, oh my God, it's hijacked my life, versus changing your cognitive thing. When your cognitive thinking changes, you are better equipped to produce solutions. You don't let that amygdala take over. Your prefrontal cortex starts giving you ideas. And I'm going back to people with dementia. You have to keep repeating this. I can't come and visit you, Mom, because there is that coronavirus. If I say pandemic, she doesn't understand. Corona, she does. Where's your mask? And she'll put it on. So we have to understand where we are and develop coping strategies. Yelling at someone with dementia or someone with an already pre-existing condition called mental illness. You have to be better at helping them, because the normal coping skills that we have lost was already lost for them. The mentally ill are more vulnerable, but there are new creations of mentally ill. This community-wide trauma in the Oregon area and California. When people are, at this level of anxiety and they get up in the night thinking the house is on fire, and every little thing triggers fire, and people are watching them, they think that's the new normal. And before you know, everybody's saying, oh my God, this coronavirus. I'm going to wash my hands all the time. I'm going to clean. You don't turn someone into OCD because of corona. Good cleaning skills. People who were already vulnerable because they were victims of rape, victims of domestic violence, or victims of fire, victims of the economy, they're already at the level at which they don't have any coping mechanisms. They've learned to be helpless. And they're more vulnerable now. And when traumas accumulate over time, psychologists are going to say it's going to be very complex to treat it. And if we wait any longer, folks, the ones who are ready to turn their anxiety into fear and possible solutions, you have to go out there and share your coping mechanisms, or reach out and help people who are not able to. So just being there for someone, just calling my brother. My mom, actually she's in a good place. When I call her after 2 weeks, she's going to say, I haven't called her for 2 weeks. She's going to say, oh, hi, how are you? She talks to me like she's talking to her neighbor, not fussing with me like her daughter. But she feels happy. But more importantly, my brother saying, we are there, and not question how he's taking care of her. So these are real stories out there. I'm trying to check and see if I'm doing okay with the time. So this young man actually moved in with his grandmother, and he needed a place. He was kicked out of the dorm because all the dorms closed. And so here was his grandmother going crazy with the computer, paying bills, doing groceries, ordering groceries on the computer. And he took his time to teach her. And then there's this couple on the right side top where the husband was having cardiac problems, heart problems, and just sharing her love and care. was what she could do because she was afraid that if things went bad, this was in the beginning of the coronavirus, and this is in New York. And so people were afraid that their loved ones are going to die because medical care doesn't exist out there. But I love this third one. Look at her face. She's so happy. And she's helping this woman. My mother takes out her mask every 10 seconds. I've seen my brother deal with that, the lucky times that I've been on FaceTime with them. And she's taking her time, showing compassion, explaining to her over and over again why she has to put the mask on. So what can we do? I'm not going to leave here without giving you some tangibles. I have done presentations about well-being and stress management. So I'm going to take some of that. And my good colleague, Professor Sylvia Ben Malta, has been talking about self-care. If we can take care of ourselves, then we can be ready to take care of another person. And this analogy about putting on the air mask, in a flight that's going down is important. Then you can save others. So start with making an appointment with yourself. This is a good time to find the other things. We were complaining so much before. I didn't know that I could cook so many different foods. And my family, my son is very thankful. He says, "Oh, that is amazing." And that keeps me going. And this meeting with yourself, we didn't do that. We were always bombarded with what others were saying, and we responded to that. But when you meet with yourself, make sure you give yourself a pat on the back for every positive thing you have done. And then you talk about breathing. I wish I had more time, but just breathing and making sure this part of your head is not tensed up. You don't have to go anywhere and practice yoga. Just deep breathing, to put a timer and breathe every hour or so, because we forget. Then, you have staying with the routine. People have stressed that. Even, the former first lady, Michelle Obama. She said, in order to create normalcy, we have to provide the structure. I didn't even talk about kids. The mentally ill and the kids need that normalcy. Be ready to change the schedules, though, because if we get hung up on certainty was never the norm. We forgot until we felt the uncertainty just take over during the corona. But uncertainties were there. If you get hung up on exactly what to do and expecting everybody around you, I'm the queen of that. I learned from my father, if you sit quietly, you're not doing anything. So he would say, study, do something. And I had the same kind of thing until people said, no, you do that. I need to rest. My body sometimes says, you go, I'm not coming. So be ready to change schedules, but schedules keep the normalcy. So meet with yourself and find some coping skills. Have a schedule, because that schedule is important for you making an appointment with yourself as well. Now let's use the media to connect with people who need us. Not keep doom scrolling. And perhaps you don't have to touch anyone literally, but you can touch someone with compassion and care. Believe me, when someone touches you, literally, you can really feel if they're actually, the body language is powerful. They can see that through Zoom, Facebook, FaceTime, or any of that stuff. So use your social media in a positive manner. And I told you, if you actually develop these positive virtues, I'm not saying I'm there, but I'm trying my best. Develop these inner potential and experience joy and happiness. It's guaranteed you've already changed the world. And democracy begins with us. Michael, I'm not going to leave without talking about democracy. And in order for us, we the people, to take in charge, we have to take care of ourselves and each other. Democracy demands that we meet our personal responsibility. I have a typo there. Democracy demands that we take charge of our personal responsibility, especially in times like this. The pandemic requires us to be responsible to ourselves and to others. It's not about your rights being taken away, but it's about the role you're going to play so the entire community can come back together. That's what we all want. We miss it. So let's beat it. Your grandmother told you to wash hands regularly. It's not from corona. Social distancing, I know we are a little bit taking it a little bit further, but I was told don't just keep hugging, because some people may not like it. Watch, how people feel about you before you just invade into their private area. Wear a mask in public. Cover your mouth. Your grandmother said that. Don't talk to people or sneeze. How is that different from wearing a mask in public? We're not asking you to wear a mask at all times. And I'm again saying this as a scientist, social scientist, because we know this corona come at you. It doesn't wait for you to come to it. And mask is a powerful thing. I've had students call me and say they have been tested COVID positive. And if this was regular time, I would have said, stay at home, you'll do yourself. And she was sick. So I said, don't worry about any of this, because you have to stay healthy in order to do any of the other stuff you want to do. So let's do it and beat this thing called corona. And that's what democracy stands for. Us being together and working together, and not necessarily waiting for this politics to change and happen. Because if we don't change, none of this is going to change. And thank you for the opportunity to share my feelings and some professional background with all of you. And Michael, I'm ready for questions or anything that anyone may have or you may have.
Thank you very much, Vi. That was very thought-provoking. And we do have a couple of questions and comments. This is not so much a question, but someone has observed that myself and several people I know have required an increase in antidepressants at this time. So it's an observation rather than a question. I guess maybe a question I could build from that is that, are you aware of trends in prescription drugs in the last 6 months?
Absolutely, Michael, and the ones who asked that question, not only the requirements for the drugs have increased, but also demand for psychologists. And the good news about psychologists, because that's what I pay attention to, they're doing teletherapy, which is much more accessible. Even our college offers an app that reaches, psychologists. Yes, there has been an increase. And so you're not alone. And hopefully you allow people to help you, because drugs cannot take care of all the thoughts that go in your mind. Okay, so my a timer. That was my timer. And I hope I answered your question, Michael.
Yeah. There's another question that's popped in. Do you think the pervasiveness of negative stories in the news leads to a numbing or desensitization effect on people?
Absolutely. And that translates to what I said earlier, learned helplessness. That's not being able to do anything. It's a paralysis, psychological paralysis. And that has been observed before in depressed people, people with depression, but it's actually affecting many people now because we have succumbed to all the negative stories, and our brain has been hijacked. And the negative brain, has different kind of neurotransmitter levels that it's ejecting versus a positive brain. A positive brain is ready to take on any challenges. So if you're already here and something comes even higher, this brain has no coping mechanism to get any higher than what it can. And so this learned helplessness and desensitization, as you may call it, is what happens. But if the brain was at this level, or we can bring it down with simple coping mechanisms I talked about, changing your cognitive thinking, gives an opportunity for the positive brain to feel something. That desensitization goes away. When you feel something, even if it's fear, you are likely to generate coping skills. And good coping mechanisms will start coming in, or you may seek to find these coping skills that are out there. And I'm telling you, there are people out there online wanting to help people. And many of them are not charging. And so there are psychotherapists out there who can offer this online. Michael?
Very good. And I don't see any other questions. I wonder if you had any other parting thoughts. I think you wrapped up on the theme of democracy extremely well. And I'm grateful you did that, because that's one of the great things about this forum for me, is seeing people from other disciplines teach and bring in their specialty, their academic discipline within this banner topic of democracy, because it's all part of our common experience and it's part of the common good, I would say.
And I wasn't a politically aware person, but thinking about democracy and things, I go way back, Michael. You gave me opportunities in the past that made me think about the political systems. It's a context. Context becomes very important in understanding behavior and assessing it and generating into proper interventions. And we are lucky, democracy, and they have no say in the matter. They have to take what's given to them. I want to take the Italian model. How many of you heard in the beginning? Italy was the most affected, but what did the people do? They opened the doors. They lived in compact homes, and they were singing to each other. That you don't have to go to a school to learn that. It was within us. They just dug deeper into themselves and came up with this beautiful idea. Believe me, if I can sing, anyone can. I can dance, but I can't sing. But I've been singing quite often these days, because singing releases different kind of neurotransmitters. Different levels of neurotransmitters and other chemicals. The metabolism changes, and we need to do that to beat this, because even biologically speaking, if your immune system is functioning at the optimum level, it can deal with more things. But if you are depressed, your immune system goes down too. The brain and body works together. So that's my parting thought.
Yes. One more question before we go, this just came in. How do you suggest we deal with those stubborn friends and family members who don't take the virus seriously and don't wear masks or wash hands when needed?
And you're going to find them as well, right? And I always say this may not be a good solution, but don't waste your energy on things that can't change. Perhaps if you role model it and change people who are willing because they didn't know any of this. If you're a biologist, talk about something that actually allows you to take what's out there and summarize it for someone who's just has politicized the whole thing, even science. So it's in you. And, as a family member, you do exactly the same thing I told you. You take care of yourself and, do these behaviors and hopefully they'll catch up. But if you spend enormous energy trying to make them think like you, it's not going to happen. And I said, this doom scrolling is what we do best. So take something this other person is already doing. Maybe they're washing hands without even knowing. And remark how, say something nice about that. And perhaps they'll catch on. But remember, you can only, change so many people at a time. But it'll have a mushrooming effect if each one of us take a few people, and hopefully it'll have a dominance effect at the end of it.
Very good point. And our colleague Beth Finders has weighed in, adding that exercise and nutrition are critical to mental health. And I totally concur.
And
this
Beth,
has been great. Yeah.
Beth Finders is a good friend of mine, and she has beautiful ideas, and she's also a psychologist. So absolutely, and she does both of those things. So, I'm not the a person who has all the solutions. I just shared some that I thought, that has worked for me. But absolutely, there are, in that area where I said, take time for yourself. You could take what Beth and even Sylvia has told us about taking care of self, and absolutely important because that keeps your system going in a healthy manner. You take care of your brain and your body, and exercise is a good way to do that. And eating right, you can't go wrong with that ever.
True.
Thank you.
Thank you very much. And thanks
Thank
to
you.
everyone who attended. And thank you for your questions and comments. And please stick around for 11:30. We have a great panel, and then 1 o'clock as well today. Thanks, everybody. And thank you, Nick.
Thank you, Mike, and everybody. Take care.
Terrific. Thank you. Yes. Thank you, sir.